Your Health Watch tonight, a breakthrough for women who have to undergo a mastectomy. A Central Florida doctor has found a way to reconstruct a woman's breast by taking fat from other parts of the body. Fox's Chase Kane shows us how.
Often in the operating room performing plastic surgery on patients, Dr. Jeffrey Hartog never imagined his patient would be his own wife.
From my perspective, I wanted to do the right thing, what I thought was the best approach.
But Michelle wasn't opting for cosmetic surgery. Quite the opposite. Her personal doctor diagnosed her with breast cancer.
I said, well, what would you do if it were your wife? It's the question I always pose to the doctors.
Choosing a mastectomy, then chemotherapy, then another scary diagnosis for Michelle only months later, involving her remaining breast.
And at this point, I decided I was going to only get breast cancer once. That was the only time I was only going to get that once. So I had a second mastectomy. At that point, I wasn't sure exactly what I was going to do for reconstruction at that point, but I kind of had an idea because my husband was just at that point exploring fat for reconstruction for breasts.
A complete coincidence that Dr. Hartog had just learned about a breakthrough procedure to naturally reconstruct breasts. No implants, just using a woman's own fat. Exactly what his wife needed.
It was by far the best option in my mind. You know, that's really what got me seriously into the actual reconstruction part and sort of expanded my practice.
There are people that have come in here that want an immediate fix, and really, if you want a quick fix, this is definitely not the way to go. If you want a fix that is relatively complication-free and you don't have to spend a lot of time in the hospital, and you want to use your own tissue and not have an implant, then it's perfect.
It's actually quite simple in terms of what we do. As Michelle said, we need a dedicated patient. It has to be done right. But the biggest instrument I use is a needle. So this is a scarless technique, essentially, no new scars. We basically do liposuction and then re-inject fat in the right way.
Think of it like a layer cake, where each time the woman goes in, the surgeon is adding a layer of fat, eventually stacking layer upon layer, so that by the time the procedure is complete, from the outside, you would have no idea that there are those layers inside.
And they look really natural. I mean, that's the part that's really amazing. Like when you put on, you know, I ran into somebody not too long ago, and they had no idea that I'd been through this.
And since his wife as his very first patient, Dr. Hartog now frequently does the same procedure on other women after losing their breasts to cancer.
This is about as close as we can come to replacing a breast. I think this is becoming more and more choice that may be at the top of the list.
Chase Kane, Fox News.